Hi everyone, it's Dr. Odette Suter here. Hi, how are you all doing? Welcome to the Q&A for the Dog Detox Summit. It's just so good to see you all here. I hope you can hear me, and I also really hope that you had such a wonderful time watching these videos and these interviews and presentations from the amazing speakers. I certainly spent the last couple of weeks kind of catching up and still have a couple more to watch. So I hope you're not going to ask me questions about those. But in any case, it's just been so amazing to see again how these amazing speakers are bringing so much information and also so much love. So hello, Michelle. It's good to see you, a neighbor. And so hello, everyone. I just wanted to maybe give everyone a minute to tune in. So let me know where you're from and where you've been listening to. Hello from Costa Rica. Hi, Kim. It's nice to see you. And also, let me know which talks really made an impression on you. And then, of course, drop some your questions in the comments so that we can address those, because that's what this is all about, is to answer the questions that you have. And I have a couple of them that I've saved throughout the last few days that people have asked in advance. So I definitely want to answer those. Hello, April from California, Sue from New Hampshire, Lisa from Florida. So it's so good to have you all here. So just for those of you who don't know me that much yet, although you probably got to know me a little bit during this summit now. I'm Dr. Odette Suter. I'm a holistic veterinarian, and I've always been very interested in healing, and healing in a way that is, not beating around the bush. So I'm a very direct person, just as a person, but also very direct in my healing. So I don't fuss around with a lot of things that are not necessary. So I always dive deep into what the root cause of issues are. And this is really what this summit is about, is to figure out, what is causing all of these diseases that we see in our animals, what is contributing and how can we help them. But it always comes down to figuring out, what is going on and what do they need. So before we continue, I want to remind you that the summit is going on for another, for 48 hours total. So it started yesterday at 6 a.m. Eastern time, so until tomorrow 6 a.m. So if you do have to pull an all-nighter, go right ahead. Because it definitely is a lot of good information. But if you don't want to stress yourself out, you can obviously also purchase the summit so that you can always go back, because there's so much information in there that can help you. And you may want to just watch one and then start implementing some of these things and then move on to the next one and that sort of thing. So it can be a very good resource to just have at your disposal whenever you need to continue. Because the thing with detoxification is that it's a bit of a step-by-step sort of approach, and it's not something that you're going to do from one day to another. So it takes a little bit of time. So that way, as you're allowing that time for your animals to heal and detoxify, it also gives you time to then digest all of these different things, and then just add little tidbits to your animal's protocol. So in any case, there's a premium offer that Pet Summits has for purchase. I know it does expire at some point. Jindy, maybe you can put that in the comments, how long the special is. I mean, obviously it's always available for purchase, but right now they have Pet Summits is offering a special deal for people who want to purchase it. And obviously, I also want to give a big thank you to the entire Pet Summits team for, pulling it off once again. This is the second round, and so thank you for that. Thank you, Jindy, you're in the background here, and Isaac and Mitch and the entire team for everything that you're doing to spread the word and help people with their animals and bring so much love and information. You guys are amazing. and you're putting together some really amazing summits. So highly recommend sending them a little bit of love and also sending them a little bit of feedback of how things have been for you. And we all want to know how we're helping and how things are changing for you, because well, we need feedback in order to also be better at what we're doing. And so you guys are like big for us to do that. Anyways, I also want to give a big thank you and a shout out to all of the sponsors. We have Animal Biome. They have sponsored the event last time already, and they are sponsoring it yet again. And they do have a special discount for you, special offer for you. And so does Ion from Intelligence of Nature. That's Zach Bush's company. And I hope that you were able to watch his talk and his interview with me. It was really quite impressive. We went from, one end to a whole different end of things. So it was a really amazing talk. And then, so he has a special offer as well. And then we have Innovative Pet Labs. They are specializing in markers, GI markers of inflammation and, how well the gut is functioning. And so they have a special offer as well. And then apparently there's a fourth sponsor that I just found out. Apparently that's me. So I guess I'm a sponsor too. And I don't have a special offer that way, but I definitely have my 7 Pillars of Health ebook for you guys to download as a free gift. And then you're going to get an email from Pet Summit about the vaccine course that I have, which will be half off. So I guess that's my offer. Put on the spot right now. Yes, and Holly and Colton, they're the owners or the founders of Animal Biome, together with Alex. I can't remember her last name now, but they're a few of them that have founded that company together. And they've also made a huge difference in the world of animals with everything that they're doing for the gut, for gut healing. And that's one of my specialties is gut healing. And that is a part of detoxification as well. And I will start diving into that. So thank you again to all of the sponsors. And obviously a huge, huge thank you to all of you who are listening and watching and who are here right now too. I love you all. It's, we're all in this together. We're a family, we're a village. We all need to pitch in, and I provide education and you guys then take it further and apply it to your animals. So it takes all of us to do this. So really amazing. So thank you for being here. So I just want to briefly kind of summarize a little bit, because I know in these 2 days, if you even watch like 5 of the interviews and presentations, your head is probably spinning a little bit. I have to say that my own head is spinning a little bit as well. Yes, April, Dr. Kanga's presentation was really quite incredible. Definitely a big, big part. So what I want to do is I want to just kind of bring it back together and simplify it a little bit and give you a little bit of a roadmap of where, how to go about things so that you can do it safely for your animals, because there's definitely a way of detoxifying that is not safe, where you're basically just throwing detox supplements at them and the body then goes into crazy mode and gets sicker. So I want to get you started, with understanding these steps. And I think I posted it in the Facebook group for Pet Summits as well. If I haven't, I will do that when we're done here, because I have this roadmap sort of planned out a little bit so that it's easy to understand for you guys. So you always want to start with the basics, because when we look at health and disease, when an animal is sick, there are 2 causes of that. Either they're deficient in something or they have excess of something. So excess would be toxins, deficiency would be, lacking certain nutrients or the right amount for them. in their food. And so when we have these two things happening, and most of the time, both of them are happening at the same time. So we have deficiency and excess. So when we have that happening, the cells of the body cannot function properly. So they will do the very best they can, but they can't function at the level that they should. So there can be further accumulation of toxins because things are not being processed. So the first step in detoxification is really to provide them what the body really needs. So we need to provide them with the nutrients necessary for these cells to be able to function. So we have to kind of upgrade the functionality of these cells a little bit. And we can do that with nutrition. So simply switching them from a diet that's highly processed and not really providing all the nutrients that they need in a fresh sort of absorbable form, we switch to a more fresh food diet that's more species appropriate, that's more balanced, that's fresh, that really provides energy, because food has energy. Like if you look at like kibble, for example, a dry food, or cornflakes, or apparently what was pretzels? Oh yeah, pretzels have about the same amount of nutrients in them as kibble. So when we look at that, it's kind of dead material, right? So we want to feed them a really fresh food diet so that they can have all of the nutrients that they can get for them, for their cells to be able to start functioning a little bit better. So that increases cellular energy, and that makes the mitochondria work better. The cells can then also release some of the waste a little bit better because they get all these good nutrients through the diet. So that's always the first step. And that needs to be done slowly as well. So you don't want to go, one day you're feeding kibble and then the next day you're switching to a raw diet, for example, which, some animals will tolerate that just fine, but let's just not try it out, right? Because we want healing to be progressing upwards gently. We don't want to have these ups and downs, roller coaster rides. So I always err on the side of safety that way. So you want to do that. And then while you're doing that transition to a better diet, to a healthier diet, you can then start looking at your own environment. What's going on? What kind of products are you using? What kinds of preventatives are you using on your animals? What personal care products are you using? What are you spraying in the yard? All of these things that you can start to look at. That way you don't feel completely overwhelmed. So you have two things to do. You start with switching over to a fresh food diet, and then you also look at your environment and start to kind of evaluate what's going on there. So I think that's pretty simple, right? So that would be the first step. And obviously also providing them with clean filtered water. And I don't want you to have to do all the research on filters and all of that. I do have information on filters in the water presentation that I did for the summit. But the simplest way, if you do not have a filter, take a big jug, go to your local grocery store. They usually have like a filtration system, like a big one. It's reverse osmosis. So you just go there, have your big jugs filled, schlep them back home, and then start giving that for your pets for drinking water. So that's pretty simple. So we want to keep things really simple. We don't want to go into overwhelm, right? And then the next step then would be to help support the detoxification organs. And I want to refer you back to Dr. D. Blanco's lecture on that. I hope you had a chance to watch that, because that's really where she talks about all of these detox organs and how to start getting them to open up. Because making sure that the detox organs are working properly, it's like, unplugging the sink. If you have dirty water in it, you want to unplug it. You don't want to add more fresh water to it, because then, you still have the dirt in it. So you want to start unplugging that so that things can really start to drain out. So that really includes healing the gastrointestinal tract and making sure that the cells of the gut lining are really tightly connected, that nothing is irritating the gut lining, and then also replenishing with good microbes so that these microbes can also help with detoxification. And for those of you who may not have heard the story, there was a psychiatrist who was working with children who had autism, and she did a hair mineral analysis that Dr. Ava Frick talks about. And she saw that there were a lot of heavy metals and other kinds of toxins in the hair of these children. And all she did for a year was work on their gut health. And after a year, she retested the hair analysis, and a lot of these chemicals were gone or significantly decreased. So a lot of things can be done just by fixing the gut, because all of these little microbial, I call them elves, in there are super important for detoxification. They help the liver, they help the kidneys, they help the lymph. I mean, they help with everything in there. So if switching to a fresh food diet, changing away from some of the chemicals that you're using in and around the house and on them, and then fixing the gut, that, I mean, that's like probably 80%. You're already 80% there with the detoxification. So next step would be to then provide all the nutrients as well for the liver and kidney to support them a little bit better, but that can also already be done once you're, adding more fresh food to the diet. And Dr. Katie Woodley talks a little bit about these fresh foods that you can add. And then obviously Dr. Blanco also talked about that. And then we have mushrooms and other things that can also support. But I don't want to overwhelm you. Let's just keep it simple, because otherwise you're just going to end up with like a, cupboard full of supplements that you'll never use. And again, you want to go slowly, because you want to use the things that are really working and really impactful, and not just do a lot of frill around it, as I call it. You want to, go right for the good stuff, and we don't want to end up with a supplement graveyard. So that would be then the next step, and that all of that will already help tremendously. And then lastly, if there are significant toxicities, and you can figure that out with doing hair analysis, for example, then you can add a little bit of binders, more specific binders, to help pull these out if they're really high. But most of the time, if we just get the body to work a little bit better, we heal the gut, we support the detox organs, we feed them a good diet, we eliminate the toxins that we can control, because, a lot of toxins we don't have much control over. But if we eliminate what we can control, you're already, you're 95% there already. So I just wanted to kind of keep it really simple, so that you have a good understanding of the process. And because I know this was so much information and a little overwhelming probably. And I just want to mention too, in regards to eliminating the things that can be challenging, that's something that you can also do in the very, like starting today, is turning off your Wi-Fi when you're not home or when you're not using it, because that way you're already creating an energetic space for your animal that is much healthier, much more health promoting, and more relaxing. Because even just, I know we live in a world of technology, so a lot of things we can't change. And, we get exposure from neighbors if we live in an apartment building and such. But if we can just diminish the level of that already without going crazy, that already will make a big difference as well. All right, so let me have a look on that note to see. I just want to make sure I mentioned everything. So I want to have a look at the questions that you guys are asking here. I just want to make sure I'm not missing anything. All right. Okay, so regarding Dr. Kanga's presentation, since x-rays with anesthesia is necessary to really know if there is a dental issue, should my 15-year-old 14-pound dog have a dental, and how often? So obviously with an older animal like your dog, April, you would want to make sure that you do a good physical, that your veterinarian does a good physical exam, and also check their heart. And a lot of veterinarians now are offering that, where they do a EKG before the anesthesia, just to see where they're at. And that EKG gets sent to a cardiologist, and the cardiologist looks at it to see if there's any particular issue that you'd have to be concerned about. And then that, if there was something, then I would recommend getting a cardiologist to do an echo just to see whether, your animal is a candidate for surgery or not. For that pre-anesthetic, you know, checkup, you also obviously want to do good blood work. I usually do a senior panel for that just to see what are the liver, what are the kidneys doing. That also can give you information on whether they would be able to tolerate anesthesia. And if they do have a little bit of changes, how can you support them through that? Because, for example, a dog who has a little bit of kidney issues, they can still go through anesthesia just fine. They just need a little extra fluid ahead of time so that they can really flush out the drugs afterwards more easily. So it's definitely a possibility. But it very much depends on how healthy your animal is. And generally for dogs that are smaller, like the, 14 pounders and less, or a little bit more, it depends a little bit on how their facial structures are as well. The brachycephalic dogs, they tend to have a lot of crowding going on. So for those, it's more important to do it more regularly. So generally, once a year is probably a good amount to do it, or to be proactive, to be preventative. But it depends a little bit on how quickly they add tartar back in, and how their health is. But generally, once a year would be good. I do tend to use a preparation protocol to help them out. It includes a lot of vitamin C and a little bit of detox herbs and supplements ahead of time and then after as well, so that they can get, rid of certain chemicals and toxins that are being released a little bit more easily. Because the mouth is definitely a huge place where toxins can be made by microbes. Because if there's some infection in there, there's a lot of chemicals that are being produced by these microbes, by these more pathogenic microbes, and these toxins go everywhere, and the microbes go everywhere as well. So if there is an animal that has really poor dental health, that probably would be one of the first things I would do is work on dental, oral health. Because if you leave it festering in there, no matter what else you do, it's not going to give you the same results. And I've had that experience myself with root canal tooth, and then cavitations, which are basically holes that are, or spaces that are left after they've removed teeth. And fixing those, has basically given me my life back. So I know from experience how important oral health is. And sometimes when there's something still sitting there that is, affecting the body, if we don't remove that, we're not getting the same results with everything else that we're doing. So definitely really important. So I hope that helped, April. All right. And then all right, so Kim, 4-year-old rescue boxer, has been over-vaccinated with rabies at 1 year old. From her reactive aggressive behavior, I believe she has vaccinosis. Would appreciate info on detoxing with homeopathics. Yes, that's not uncommon. When we think that an animal has vaccinosis. So for those of you who don't know what vaccinosis is, it basically means an adverse reaction to vaccines that then shows up with symptoms. So then basically whatever these symptoms are then called vaccinosis. So that can be aggression, and especially with rabies, it can be aggression. It can be eating inanimate objects. So if your animal had a rabies vaccine, and then all of a sudden they start eating everybody's socks and sticks and God knows what else that they didn't do before, that's a sign of a vaccinosis, like an adverse reaction to the rabies vaccine. With rabies vaccines, generally, it's more of a behavioral change, because rabies, the disease itself, is a neurologic disease that affects the brain. And a rabies vaccinosis is very similar to the actual disease of rabies. Obviously, hopefully, in most cases, not to the same extent, but it's also affecting the nervous system and the brain. So behavior changes. If an animal, for example, starts to be barking at cars more. I had one patient, he started barking at cars more after I vaccinated him for rabies. And so then we did a little bit more detox on him and he stopped doing that. I had another dog who was doing some fly snapping behavior. That was also from a rabies vaccine. Unfortunately, the owners didn't know at the time, and the vet also didn't know, and so they vaccinated him again, even though he was on seizure medication for the fly snapping, and everything got a whole lot worse. But thankfully, they came to me, and we kind of dealt with that, and the dog was much happier. So things like that, or being afraid of water, hiding, or being excessively outward. So it can be going in any different direction. But anytime you give an animal a rabies vaccine, you just want to keep a diary and see, what's changed, what is different. And then let your holistic veterinarian know. If you let your conventional vet know, they're probably going to think, that's not a vaccine reaction. If you don't have a vaccine reaction within 3 days of the vaccine, they usually dismiss it as something else. But holistic veterinarians and especially homeopaths are very, they pay close attention to that. So regarding detoxification of vaccinosis, if you have like a vaccinosis that set in and it's been there for a while, the best way to really detox that or help that animal would be to work with a classical homeopath who has studied and is practicing homeopathy, like Dr. D. Blanco, for example, or Dr. Todd Cooney, because when they have, each animal will have a different presentation of that vaccinosis. So in one animal, it may be that they're eating a ton of sticks, but they're also hiding in the corner, whereas another animal may show different signs. And so depending on what that picture is of what they're expressing, there will be different homeopathic remedies that you would use for that particular animal that takes the entire animal into consideration, including, for example, yawns a lot, or loves to be on heat vents, or prefers the cold. So there are so many different parts that will then make a whole picture of what's going on, and then the homeopathic remedy is then basically matched to that. So in that case, there would be different homeopathic remedies. But one that I usually send home with people when they had when their animal had a rabies vaccine would be Lysin or Lysin. It's Lyssin. So that would be one. But again, from a classical homeopathic perspective, that's kind of, not perfect for sure. And so if I have an animal that has real vaccinosis after I gave them a rabies vaccine, which thankfully I don't have to do a lot because a lot of my animals are sick enough for me to be able to give them an exemption letter. But if that were the case, and it's a little bit more pronounced, I would definitely send them to a homeopathic veterinarian to help them out, to work on that, because that's important to them become really individual in the way that you approach it. So I hope that answers your question, Kim. I know you wanted like specifics, but when it comes to vaccinosis, it's really best to work with a homeopath who can really give you very specific remedies to work with. All right. Yeah, Chris, great suggestion. All right. Oh, okay. So I have some question here. Now doing acupuncture and ozone therapy, I would like to know how I can help in detoxification process for liver and whatever I need to do. Thanks. So that's Irene. Yeah, that's awesome that you're doing acupuncture and ozone therapy. That's certainly very helpful. If you remember from Dr. D's talk, there are a lot of nutrients that you can give to help promote and support liver and kidney function. For example, garlic, certain amino acids, milk thistle, there are all sorts of things that she listed there. So I would have a look at those. And then if you haven't already, maybe check the microbiome, see what is going on with your dog's or cat's gut health. and see if there's some improvement that you can provide from that perspective, because that is important. And I mentioned that earlier. I think you posted that question while I was still talking, so so I probably already answered it. Um, and then, adding a little bit of binders just to kind of help pull things out of the system. And since we're mentioning binders, I had one question as well, or a couple of questions around binders actually. One was, charcoal is specifically helping detox all the way around? Question mark. So charcoal is is something that actually stays in the GI tract, so it doesn't go into the circulation. So charcoal would be a really great binder if you're binding something in the gastrointestinal tract. It's also great, if your dog ate something that they shouldn't have, after you get them to throw it up, which that's always the best thing. And then once they stop throwing up, obviously, then you can give them a little bit of charcoal to, help bind whatever may not have come out. So charcoal is a bit more of a binder that stays in the gastrointestinal tract and just binds things there. One word of caution regarding charcoal: you have to give it about an hour and a half to 2 hours away from medication, and preferably food as well, because it also has the ability to bind medications and also has the ability to bind nutrients from food. So it's best given on an empty stomach, away from all of that, so that it doesn't interfere. But for example, if you're giving like a heartworm preventative or anti-parasitic drug because your dog has parasites, then you could, give that drug first, give it a couple of hours so that it can really do its thing, and then give a little bit of charcoal to follow it up, so that it will not only just bind, any leftover, medication or toxins from that whole process, but it will also help to bind the toxins that are being released from these parasites, because parasites bioaccumulate toxins. So they can basically eat up a lot of toxins. And then as they die, these toxins are being released. And where are they released? They are released in the gastrointestinal tract. So if we follow that up with some binders, then it can help to drag these toxins out, rather than the animal then reabsorbing all of the toxins through the gastrointestinal tract. And there was another question on binders that I had found. Actually, you know what? We'll skip that for later. I think that was, but in any case, with binders, there are different binders, and different binders have different affinities to certain things. Some are stronger binders and some are weaker binders, meaning that they can either really tightly attach to the toxins and not let go, and drag them out of the system. And there are other binders that are weaker, where they don't hold on as well, so they can really, the toxins can detach again. So cilantro, for example, is a little bit of a weaker binder. So it's always good to maybe layer the binders a little bit. That's what I do for myself. I will use a little bit of cilantro, but then I also add some chlorella, and then I have another binder. It's a biotoxin binder, which is more from fulvic acid, fulvic minerals. That is more of a tighter binder. So I will layer these a little bit as well to, tie up all of the different toxins that are floating around, of which, we have lots of them. And certain binders go more into the system. Certain binders, there are some that will also address the toxins in the brain, because the blood-brain barrier is usually pretty tight. So you have to have certain binders that can go through the blood-brain barrier and pull the toxins out. But that's usually the last place. You want to really start, with the gut, clean that out, make sure all the toxins go through the kidneys and liver well, and then you just go further and further. So it's again, it's like a drain. You unplug the drain, and then things kind of will start to trickle out. So you can add some binders, but the body also knows how to detoxify itself, so it will do its thing in the right way. So it's important to also definitely listen to your animals and see how they respond. If they start to be more itchy or more cranky or have more, diarrhea or discharge, you may have to slow it down just a little bit to allow the liver and the kidneys to catch up to really, get rid of things. So it has to be done, at a pace that is doable for the animal. I do hear a lot of people who say that, oh, my dog has been detoxing for a year, the skin is horrible and, and such. And that, I always say that's not detox, that's re-intoxication most likely. And there's a lot of inflammation going on. So we need to do whatever we can to kind of slowly start to decrease that inflammation and enhance the ability of the body to release things, because toxins are released through the gut, kidney, liver for the most part. But the skin is a detox organ as well. The ears help with detoxification as well. So if there are a lot of things going on more on the outside, like the skin, the ears, etc., it's probably also because the other detox organs are not functioning quite as well as they should. So we want to make sure that the insides are, doing their job in detoxifying. And then Dr. Blanco mentioned baths as well, because that can help to pull out some of the toxins out of the skin and from the hair and such. But generally, when the symptoms get worse, that's usually a sign that detox is not working quite the way it should. So we should have very minimal symptoms really from detoxifying if it's done properly. And I am more than happy to help with that and help guide you with that. All right. Okay, next question. So, Carol, you have two questions. How can I get NYS to accept a titer for rabies? NYS, I'm assuming New York State. Different states have different laws regarding rabies. No state that I'm aware of accepts titers for rabies instead of rabies vaccines. That's unfortunately a little bit of a myth that's going around that some states will accept that. I think it was Delaware. They accept titers if an animal has a medical exemption letter. So the animal has to be sick for them to accept the titer instead of the rabies vaccine. But that's just Delaware. But most states, like for example Illinois and others, they allow veterinarians to write a medical exemption letter, and that basically then exempts you from needing a rabies vaccine. A rabies titer is not accepted by law. That's just the reality. And certain states are more difficult than others. Some states, they have to have a state veterinarian approve the exemption letter. Other states are more lenient, like again in Illinois, where they don't really check. So unfortunately, that's a little bit difficult. So getting New York State to accept it, I mean, you can work with some of the people who work with Dr. John Robb, who does the Protect the Pets. He's kind of made quite a bit of noise in that regard, and they are working with lawmakers and such to start to change the law, hopefully. So you can see who in your state is kind of spearheading that movement and see if you can help them out to start to change the laws, because it's really ridiculous. I agree, but unfortunately, it's the law. And then you have another question. You have a fenced yard, but a neighbor who uses a spray lawn service. What can I do to keep my pets safe? Certainly, you could maybe speak with your neighbor if they're open to it, and if it doesn't result in a fight, because that usually doesn't really help. But certainly when it's happening, what you could do is you could ask your neighbor to let you know when they're coming, because that way you can take your animals inside so that they don't get sprayed even more. Closing the windows, closing the doors while it's happening is good too. And then maybe for a few days, just go out somewhere else for walks. Give them regular baths just to get some of that stuff off, especially their feet. yeah, that would be kind of my suggestion in that regard. But it's difficult, with all these people who spray things. Unfortunately, yeah, it's difficult. I mean, you can certainly build a tent over your whole property to keep it out too, but it's yeah, it's one of my challenges too because my landlords they spray and it just drives me insane. Every time they come, I have a fit. And I start yelling because then they get close to my veggie garden and I'm like, no, go away. It's windy. You're spraying it everywhere. It's going everywhere. Yeah, unfortunately, it's difficult, and I think it's just going to take more education and more, unfortunately, more people and animals getting sick from all that stuff for things to really change. It's a sad state of affair, but if your neighbor is in any way open to alternatives, possibly, you know, yeah, maybe do that. Maybe ask, have a chat. All right. So, Steph, you're asking, with all the things to prioritize regarding pet health, do you recommend focusing on removing all polyester dog beds and toys? Oh, that's certainly a good way of eliminating some things because that's easy to do. You just do it once and it's done. So that's a pretty easy one. Um, is it the priority for their overall health? I wouldn't think so. I mean, certainly every little bit counts, but I think I wouldn't say that it's, prioritizing that. I think it's just one aspect of it. I think prioritizing nutrition and gut health, those are the two big things, and then removing everything else that is also toxic to them, and finding alternatives. Dr. Judy Morgan talks about alternatives. Dr. Katie Candice talked a little bit about alternatives as well. So that would be kind of the priority, um, like the basics to do. And that can make a huge difference already, not over vaccinating, that sort of thing, finding alternatives for flea and tick prevention. Um, yeah. All right. So Jill, if we are following the natural suggestions discussed in the summit, how important is expressing the anal glands? Thank you. So anal glands, they are in a way part of the skin. And what I very often see is animals, when they have allergies and are itching a lot, they tend to also have a little bit of anal gland issues sometimes, where it seems like they need to be expressed all the time, but they're just itchy. And I will always check them to see, obviously, if they're increased in size. But very often these anal glands are empty. It's just that they're itchy in that area of the butt. And is it really the anal glands? Maybe not. Maybe it's just the skin of the anus and that neighborhood there that is causing, that is just itchy. So I don't think I would necessarily express the anal glands unless they're really filled and really bothering the animal. I sometimes will express anal glands when I'm not sure if there might be a little mass in there. So I will always check, do rectal exams, especially in the older animals, because sometimes they can get little anal gland tumors. So I will just express them if I'm not sure if there's a little bit of a harder aspect, like a little mass in there. But otherwise, I generally tend to just leave them alone. All right, Jill, what suggestions do you have to address fatty tissue deposits? So, fatty tissue deposits, I think they're a little bit of the garbage can of the body where they store toxins, where animals will store toxins, because fatty tissue, a lot of the toxins that we have in the world are fat soluble toxins. And fat soluble toxins, they have affinity for fatty tissue, and storing them away into fat takes them out of circulation and makes the toxins a little bit safer, so to speak. I mean, it's still causing damage, but it takes them out so that the animal isn't feeling really, unwell. So when we want to address these fatty tissues, it's basically just the same as I just mentioned. We want to feed the cells what they need, and we want to remove what they don't need. So just that process of basic detoxification, of providing good nutrients, fixing the gut, supporting the detox organs, etc. That can all help to start pull these toxins out, because it's a bit of like a concentration gradient. You have a lot of concentration, but then you start unplugging the drain, and then slowly the concentration will get less and less. Are they ever going to completely go away? I don't know. I can't really say that I have a lot of um, I see a lot of change in those, but even if they're not getting any bigger, that can be great, because the thing is, once these little fatty tissue deposit, tissue areas, these lipomas are there are the cells are there. So are they necessarily going to go away? Maybe not, but maybe the toxins are still being drained out of those. So just focusing on the basics, that's always where I would go and focus on, because we tend to get a little bit, lost in the weeds. So always going back to basics: good nutrition, gut health, supporting detox organs. And then if they need more, we need to, check out what the hormones are doing. Maybe they need a little bit of hormonal support. Maybe they just need more exercise too, because exercise also helps to move toxins and creates lymph drainage, because a lot of the toxins can also end up in the lymph system. So creating better lymph drainage through movement, that all helps with that. But always go back to basics. What I see in my practice and when I speak with people is like always getting lost in the weeds. We always have to come back to basics. And that's why I created my 7 Pillars of Health ebook. Come back to basics, because that's where you're going to get the most power out of everything that you're doing, is go back to basics. And we all know the basics because our ancestors have lived with the basics for a long time, right? So we have to just go back to basics. Yeah, it's interesting to know all of these things, oh, this herb is good for that, this is good for this is good for that. And then lo and behold, you have like a, a supplement graveyard. You have like bags of supplements that the body also has to process, which can actually make the body feel worse. So we want to go back to basics and keep it really simple and give them what they need, not what we think that, could also help. And I know that can be difficult to determine. And that's why, there are so many of us that know how to do this, that are helping and offering help and support. All of the speakers are more than happy to help you with your animals, do consultations. A few of us also have programs where we help to guide you through the process, so that you really learn to think like a holistic veterinarian, and you really go to, like what's going to give you the biggest bang for your buck for your animals. So you can save a lot of money by actually finding yourself a mentor who can really guide you on that journey and help you with what's really, getting to the important parts, to the basics. And I'm going to repeat that, because these basics are the foundation of health. And I've learned that over the years from myself, because I dab a little here and I dab a little bit there, for my own health. And it took me 10 years just to get rid of my chronic fatigue. And I could have done that in like probably 6 months if I had done it, if I had had somebody who would have shown me the way. Obviously, I learned a lot in the process, and that's why now I know what works. And so, use us who have gone through all of these things and who have figured out the way to do it, that is complete, that is fundamental, that is basic, to really change things. Because the thing is, the body knows how to heal. It has the innate ability to heal. So if we just give it what it needs, it will then take over and do whatever is needed, because the body is so intelligent. It is much more intelligent than any of us, even all of us together. It's more intelligent than that. So we need to listen to the body. We need to let the body do its thing. And I think I mentioned that somewhere in one of the interviews. There was a quote that keeps sticking with me, where a doctor said that doctors are simply there to entertain the patient so that the body can heal. So, move ourselves away a little bit and let the body do its thing just by providing what it needs and taking away what it doesn't need and what's injuring it. So if you get that, you're way ahead of the curve. So keeping it simple and fundamental. All right, so my Yorkie life is asking, is RX clay a binder that can help daily as a preventative for babies all too often colitis? Um, yes and no. When an animal has recurrent colitis, you have to figure out what the underlying cause is and what's creating that. And very often I find that they either have food sensitivities or they have microbiome imbalance or both. And so my recommendation is usually to fix the gut, work on fixing the gut so that you can, get more relief and more, results long term so that it doesn't continue. All right. Because we don't want to have these chronic GI issues, because chronic GI issues are quite damaging to the body long term, because usually there's leaky gut, so all sorts of toxins and microbes can pass through that barrier and then affect all the other organs. So working on fixing the gut would be really important. And if you're interested, I do have a whole program where I work with that specifically with pet parents all over the world to help them with their gut issues and any of the disease related issues as well. So you can always shoot me an email and I'd be more than happy to help. But certainly, if for your animal RX clay as the binder is helping, you can certainly continue doing that. I would just maybe keep it away from any other, drugs or food, maybe, just so that your animal can still be absorbing all the nutrients that it needs. So maybe not giving it at the same time. Another supplement that I really like for colitis as well, or GI diarrhea in general, is Saccharomyces boulardii. That's a yeast. So Saccharomyces boulardii. That's a yeast that helps to decrease inflammation. It also helps to decrease overgrowth of certain microbes. So that could be another one that could be helping your little puppy. But I would definitely work on, really restoring gut health, and so that you don't have to go through this endless cycle of recurrent colitis and diarrhea and such. And that goes for anyone who has an animal with gut issues. It's always better to work on the foundation of the gut and really restore it, take away what is interfering with the gut health, and then restoring, giving the nutrients that the gut needs in order to heal, the lining, because these cells, they need nutrients. Ion gut health, for example, is amazing for that. It helps. It's always part of my gut healing program. Fecal transplants, all these different things can be very, very helpful to turn it around. But it's always good to have a bit of a whole program to approach it, so that you have that guidance to also help you troubleshoot. Because I know with recurrent GI issues, it can be really tough, because I find that people get a little bit of PTSD from it, because it's always in the back of their head. Oh, I hope my dog isn't going to have diarrhea today, or my cat, or isn't going to vomit. So they're constantly a little bit on edge with that, and that's a really tough way of living, certainly. So I always work on helping them also from a mental, emotional perspective to bring stress levels down and so on, because a lot of times stress plays a role, and also providing people with the support so that they can relax a little bit. Because I've had so many people say to me, oh God, I'm so glad I get to work with you, or with whomever they are working. It's not just me, because they're finally getting that support rather than being alone in this. Because unfortunately, conventional medicine a lot of times has nothing to offer for recurrent chronic things, because that's not what conventional medicine was designed to do. Conventional medicine was designed to work with inflammatory, like more acute conditions, and that's what they're really good at. They're good at doing diagnostics. They're good at putting out fires. But when it comes to chronic issues, unfortunately, they're still, they don't have a whole lot to offer. So I always want to provide people with support so that they don't feel so alone with all of it, so that they feel like they have guidance. And a lot of us do that. So, reach out if you need more help. All right. How much activated charcoal to give per weight of dog? I don't know it by heart. The dosage, I'm sure you could find it online, although oftentimes online the dosage is for when they have toxicity. So what I usually do is, I believe, I'd have to look into my notes. I don't use it that often. I use other binders more. But usually you'd probably be pretty safe just using or translating the dosage for a human to the dose to the weight of your dog. So if you have, let's just say we're taking like 120-pound person for like the dose that's on the bottle, then if you have a 20-pound dog, you would give a sixth of that. It's activated charcoal is pretty safe. Obviously, if your dog gets really constipated from it, then you may need to stop it or decrease the amount. But generally, it's pretty safe because it stays in the gut. All right, what kind of algae do you recommend to detox from vaccines, and how much do you give a Newfie puppy from 10 months old? She weighs about 42 kilos. Thank you for your help. So I don't generally use algae so much for detox, but certainly they can, well, actually, I just said I use chlorella. Chlorella is an algae. So yes, you can certainly use chlorella and blue-green algae, because that also helps to nourish the body aside from helping it detoxify as well. I probably would, I have tablets. I have chlorella tablets, so I probably would do somewhere between 5 and 10 tablets once or twice a day or something like that. But generally, what I use after vaccines is, and even before vaccines, actually around vaccines, so a few days before and then a week after, is I use high-dose vitamin C. I use liposomal vitamin C. So for a 50-kilo dog, so that's 100. Oh, that's actually 100 pounds. Never mind. Yeah, I probably would do at least 2,000 milligrams twice a day of liposomal vitamin C, which is a vitamin C that's wrapped in little fat bubbles. So it's a gel-like vitamin C, but it's absorbed really, really well. And vitamin C is good at cleaning things out. It kind of destroys certain chemicals as well. Shouldn't be given right before you get anesthesia for your teeth. If you're going to the dentist and they're gonna do local anesthesia, you don't want to have a high amount of vitamin C on board, because then it will destroy the anesthetic drug as you go. So we'll stop the day before for sure. If it, when it comes to dentals. But in any case, so for detox of vaccines, I usually start 5 days ahead. I start with half the dose of vitamin C, and then afterwards I double it for 7 days or so. But I also provide them with other things. I give them like a protocol from 5-leaf pet botanicals. They have a liver detox protocol, so I usually start them the week before, and then I continue a couple of weeks after, and that also includes 1 week of kidney cleansing. And that protocol comes with herbal tinctures, but then it also has a dog greens, and that has spirulina, chlorella, and other things in it as well that help to nourish the body and help to bind some of those toxins. So that's usually what I do. And then depending on the vaccine, if it's a rabies vaccine, I will use the Lysin or Lysin and homeopathic remedy, or if it's one of the other vaccines, I will use the Thuya. But again, if there are issues afterwards, it's always better to work with a actual homeopath to clean it out if there's any issue in that regard. And again, I will have a lot more information for you guys, the special for the vaccine course that I have, which is very comprehensive, includes cats, dogs, and horses as well. And then, how to detox after, how to prepare, what to watch for, when not to vaccinate. There's a whole lot of information there to help, and also what vaccines are useful and what vaccines we should stay away from, what kind of vaccine protocols to use or not use. So I provide you with all the information so that you really can make an educated decision when it comes to your pet's immunizations. All right, Steph, my Weimaraner was injured by rabies vaccine as a puppy. He got IMPA. It was horrible. He now eats dehydrated food. I give him probiotics along with Dr. Dogg's BioBlend. Should I send in a stool sample to see how his, there's part missing here. I'm assuming how his microbiome is. If that's what the question was, I would say yes. I have, gut microbiome. Also, do you recommend a high protein diet for getting rid of struvite crystals and high pH? Thank you. So definitely gut microbiome testing is quite important. I've actually started doing it on a regular basis on my patients once a year as part of their physical, or anytime they've had some kind of a procedure, be it a dental or being spayed or neutered, or if there was a stressful situation, if the owners moved somewhere, or they any, and of course when there's GI issues for sure. But I just have a boxer in my practice who we did a test on him because he just had a dental. So I decided let's just do a biome test just to see how it is, because I've had other patients and their microbiome before the dental was pretty good, and after the dental it wasn't, even though they were not put on any antibiotics. So the stress can really change the microbiome as well. And this boxer, he had his microbiome consisted of 96% of one microbe. So he had pretty much zero diversity. So 96% of the same microbe is not ideal. So anytime they went through a lot, whatever it may be, whatever the stressor was, even if you went somewhere and they sprayed glyphosate everywhere, or you got caught in a fog of glyphosate or something, it's always a good idea to do a microbiome test just to see where they're at, to balance it out. So with struvite crystals, yes, a protein that's a little higher, a diet that's higher in protein can help, because struvite crystals do form less in high pH. In an acidic pH, I should say. So they don't form as well. So it's important to provide them, and you don't want to go crazy with the protein either, because we want to mimic as much as possible what the composition of natural food would be, like prey and whatever else they pick up along the way, because dogs are not pure carnivores. They also eat all sorts of other things that they find. So we want to make sure that we mimic that a little bit, but definitely getting away from a kibble diet would be important. Feeding like a fresh food diet should be enough for that. And I had another thought. Oh, making sure that they drink plenty to get rid of them. And then the other thing too is you always have to be a little careful, because when we get urine from an animal, if we don't process it right away, little struvite crystals can actually form in the urine that would normally have been dissolved. Okay, so if the urine was not processed right away, it may be worth retaking a urine sample. Take your dog to the vet, have your dog pee right then and there, outside, and then bring the urine sample in and ask them to run it in-house right away. Because I've had that in some of the samples that I sent in, and then we retested it with because I don't have an in-house lab for urine, so I would send them to their regular vet and have another urine sample done, just to make sure. So sometimes when we find struvite crystals, it can also be that it's just a processing issue lab issue and not so much that it's a problem for the animal. And checking pH would also be important to do first thing in the morning before they eat, because that's the most accurate pH of the day. Because every time they eat, the pH will change. So taking the pH first thing in the morning before they eat, first urine, that's the most accurate way to measure the pH. And you can just get a little pH strip at health food stores have them, pharmacies have them, so it's pretty easy and easy to do. You just stick it under the stream and and you get your results. All right, Carol, what do we do about heartworm prevention? So that very much depends on how prevalent heartworm is in your area. So if you're living in Florida, it may be more important to, bite the bullet and just, get a heartworm prevention on board. That's a drug version of it. Just want to make sure that you can also do a little bit of support before and after so that the animal tolerates it better. And then also, I have some people I work with, they're in Florida, and what they do, they give a few fecal capsules afterwards for a few days just to help replenish the microbiome, because all of these heartworm preventatives, they also damage the microbiome. And so giving a little bit of help that way can be good. And then also giving a little bit of binders a few hours after you give the preventative, that probably also helps to take it out of the system a little bit more. And then you just definitely want to make sure that you're not using any sort of combination heartworm preventatives, because dogs do not need to be dewormed every month. So all of the HeartGuard Plus, the Interceptor Plus, the whatever trio, all of these combination things are just multiple drugs put together that can then potentially create more challenges for your animals. So you want to stick to just that one drug, whatever you're trying to do, stick with that. For example, HeartGuard, I think they don't make the HeartGuard without the plus anymore. I can't remember now. It's either HeartGuard or Interceptor. They don't make that anymore. But compounding pharmacies, they could compound some heartworm preventative for you, like ivermectin, because HeartGuard is ivermectin. So they can also compound it for you so that there's nothing else in it except for the ivermectin and then whatever they need to just make it liquid. So that's an option as well if you cannot find the other, like one that's just one drug. Because some of these other preventatives, they also have extra dewormers. I mean, HeartGuard preventatives are dewormers. I mean, ivermectin is a dewormer. But some of these other drugs, they have, pyranthal in it, or they have praziquantel for tapeworms, or they have some other things, and then combination with flea and tick and everything, because, well, it's easier, right? Just give one thing and then you're taken care of. But unfortunately for the body, that's not ideal. The body doesn't like that. And Dr. Judy Morgan talked about that as well. And you definitely want to stay away from the injectable heartworm preventatives, because the 6-month version of ProHeart was killing dogs. So they had to take it off the market. And then they silently reintroduced it. But in the beginning, veterinarians had to actually have the patient fill out a form, like a consent form, basically. But that sort of went by the wayside. And now they've also introduced an even stronger version, which lasts 12 months. And I mean, don't get me started with that. That's really not something I would do, because with these drugs that last a long time, once they're in the system, and there's a problem, you have no way of taking them out, because then you just have to let it take its course. And that's the same with the isoxazolines like Simparica, Credelio, Bravecto, Revolution, one of them. So all of these, they stay in the body for a period of time. So if your animal has a reaction, you can't get them out. Traditional heartworm preventatives like ivermectin, HeartGuard or Interceptor, they don't stay in the system for much more than 72 hours or so. So, they go in, they do their thing, and they're out. So I would stick, if you do any heartworm prevention, I would stick to those. If you live in a place where there are no mosquitoes, then you certainly don't need it. Or if you live in an area, in a climate where in the wintertime it's freezing cold, like in Chicago, for example, there's no heartworm transmission. So there's no point in giving any heartworm preventatives during that time. So it depends a little bit on where you are in the world, you know, what the prevalence is of heartworm in the community and so on. So that would be my recommendation. But there are certainly also herbal formulations that are made to help prevent heartworm and can also be used for treatment of heartworm. Unfortunately, there are no studies that really show that. It's just more anecdotal evidence. So in the end, it's a little up to you what you feel comfortable with. But if you're not doing heartworm preventatives or you go a more natural route, then I certainly would recommend testing more frequently, just so that you really have your animal as protected as possible. And if there's something brewing, that you catch it. All right, Kim, you've been a wealth of information. Yeah, thank you. I don't know where all that information is coming from. You guys must be pulling it out of the ethers or something in the back of my brain. So do you offer consulting for those living out of the US? Yes, I do. I work with people from all over the world through my holistic pet health and longevity program. I have people from Singapore, from India, from China, from the Philippines, and UK and everywhere. So it's really fun. And I learn a lot because every country has a little bit of their own, thing. So it's really interesting. I learn a lot and I really enjoy it. So yeah, yes, the question is yes. Hi, Dr. Odette. Hazel. My rescue Bichon barks a lot in many situations. Tried different ways to reassure Oscar he need not feel afraid. Sadly, 1 year on, he still does it a lot. We are desperate. Hazel, I don't know if you had a chance to listen to Dr. Susan Wagner's interview and also Miranda Alcott's. I think those would be really helpful, because oftentimes what happens is that the animals do something that we don't particularly enjoy, but they do it for a reason. So if we can figure out why they're barking a lot, what's going on with them, then we have a much better chance at helping them to change. And they may still insist on barking, but at least then you know why they're doing that, and you can help them out and work with training and such as well. But I think in your situation with Oscar, I think it would be really important to understand why he's barking, what he's afraid of, and then find solutions together, because that way he feels included and such. So I think that would be kind of one thing to do, is work with an animal communicator and get a little bit of help that way. All right. My Yorkie life, the Boulardi from FSO from Holly. Yeah, so it's Boulardi, Boulrdii, so Saccharomyces boulardii. Yes. Yes, Animal Biome has it. Yeah. But other health food stores have it as well. But Animal Biome definitely has it as well. And if you're ordering something from them, you could also get some a biome test done at the same time and see what's going on, so that you can really kind of fix the underlying issue. All right, should Saccharomyces boulardii be given in place of a multi-strain probiotic? And long should either be given? How long should either be given? So if you have an animal with a healthy gut, with a healthy microbiome, you do not need to give Saccharomyces, and you also don't need to give any probiotics. Okay, so if you have a healthy microbiome, leave it be. Don't fuss with it. Just feed it good food, prebiotics, which are, more the right fibers to nourish these microbes, the foods that they need. So then you don't need to do anything. Saccharomyces is good when they have diarrhea or when they have Clostridium overgrowth. So Clostridium is kind of the type of infectious agent that people get when they go to the hospital and then they come back with diarrhea. So that's C. diff infection. So Clostridium difficile, animals, dogs and cats get that too. So when they have a Clostridium overgrowth, I will add Saccharomyces boulardii, or when they have diarrhea, I will add it as well, because Saccharomyces boulardii is a great one to help with diarrhea and inflammation a little bit. I will also give it if I have to put an animal on antibiotics for whatever reason and I can't get around that. I will also give them Saccharomyces boulardii with the antibiotic, because antibiotics don't actually kill Saccharomyces boulardii, so you can give that at the same time, and that will then prevent overgrowth of certain microbes, pathogenic microbes like Clostridium, for example, because antibiotics will kill some of these good microbes. And so if we can give Saccharomyces boulardii at the same time, we have less of a chance of creating more of that imbalance. But certainly I would still test after the antibiotic to see what's going on and replenish the microbiome. Personally, I don't really sell other probiotics except for Saccharomyces boulardii, because I've never really found them to be all that supportive or helpful. I've never really seen much of a change in my animal patients. And once I discovered fecal transplants, I'm like, yeah, no. Because these multi-strain probiotics, multi-strain, it's not even that they have that many. I mean, if you're lucky, you find a probiotic that maybe has 20 strains of microbes in it. But most, the dog microbiome, the gut microbiome of a healthy animal, has somewhere between 300 and 1,000 different species of microbes. So if you just have a few species of microbes from a probiotic compared to 300 to 1,000 species, I'm going to go for the big guns, because I want to replenish the entire microbiome. I want to add more diversity, whereas with a probiotic, you can never achieve that. So that's one other thing that it's just me, and not just me. I mean, a lot of people kind of say that too, especially also in the human field. Once they discover the microbiome and fixing the microbiome, with fecal transplants and such, probiotics sort of go by the wayside. But the thing is that with probiotics, it's a bit of a multi-million or even billion industry. And of course, it's certainly still a lot better than pharmaceutical drugs. I mean, although it's good to have those too, if need be. So, they have spent a lot of money in producing these probiotics, and so they're not really all that willing to let them go either, because that'd be a big loss. But, we have learned a lot about the microbiome and how to fix it. And there's a lot of research that's also showing that probiotics don't do all that much. I mean, some will do some certain things, but the problem is too that these probiotic bottles, on the label, it just gives you, for example, Lactobacillus rhamnosus. That's a species, but there's something beyond the species, which is the strain. So that would be Lactobacillus rhamnosus, and then it would have a bunch of letters and numbers. So that would give you the strain. And so then if you know what the strain is on that bottle, you can actually see what it's doing. Or if you have a problem with your animal, a specific problem, you can Google, okay, what probiotic strain would work for these particular issues, and then you can go really specific. But unfortunately, a lot of these probiotics on the bottle, it doesn't even say what strain it is. And, if you compare it, for example, to a family, the species, Lactobacillus rhamnosus would be the Johnsons, like the family of the Johnsons. The strain would be Tom or Bobby Johnson. So it would be the individual. But within a family, you have so many differences. For example, in my family, I'm the veterinarian. I'm more sciencey. My sister, she's very artsy. She can draw beautiful pictures. All I can do is draw a stick figure. So you have to know which strain is in that probiotic so that you know what it's actually doing, because there are certain Lactobacillus rhamnosus strains that will enhance inflammation, so they will trigger the immune system, they will stimulate the immune system. But if you have an immune system that's overstimulated already, you want one that's actually decreasing that stimulation and calming things down. And that would be a different strain of that same family of Lactobacillus rhamnosus. So that's a little bit of the problem with the probiotics, is that first they're just like, only just a few strains, and then oftentimes you don't know what strains are even in the bottle because it doesn't say on the label. And then there are other problems about probiotics, but I don't want to go too far into it now. All right, Mindy, does organic milk thistle help with detoxing from vaccines? Do you recommend using organic milk thistle seed or organic milk thistle seed powder extract? Yeah, so, organic is definitely the way to go. Milk thistle is one of the herbs that can help with supporting the liver. There are a lot more as well, but certainly giving a little bit of milk thistle, I think, would be a good idea. I know certain herbalists may not quite agree with that, and I'm not an herbalist. So, but in any case, milk thistle has definitely been shown to be supportive, but it's not the cure all or the only thing that can help with detoxification. There are a lot of other herbs and supplements, and nutrients that can help with detoxification. So milk thistle is definitely not the only one. It's just the most known, I guess. But I know that Dr. D. Blanco, she has a detox protocol as well that she sells that is, I think, 2 or 3 different kinds of supplements that provide all of the nutrients that she talked about in those detox phases of detox in the liver. So for phase 1 and for phase 2, and then also a little bit of binder to get it out of the system. So it's worth kind of checking into that as well. All right. So AN, can you write down here what the name is from the gel-like vitamin C you recommend? Thank you. Yes. So it's liposomal. I don't know if I can comment. I don't think so. Maybe Michelle can write it down, because Michelle knows what it's. Oh, you already did. Thank you, Michelle. Yeah, so that's the one that I use, is the Live On Labs liposomal vitamin C. There are other companies that make liposomal vitamin C as well. Live On Labs vitamin C does have a little bit of soy in it, so if your animal is sensitive to soy, that would not be working. But Mercola has one. I think Allergy Research, and then BioPure. So there are a bunch of liposomal vitamin C's available. All right, Steph, I don't want to hog all your time. Only if you have time, could you tell me, my 5-year-old Weimaraner with the immune-mediated polyarthritis, I was told he shouldn't have raw diet. Do you agree? He eats dehydrated. Well, I mean, dehydrated is close to raw, so that's good. I don't know who mentioned that he shouldn't have a raw diet. Well, actually, if he's on immunosuppressant drugs, that's probably why they would tell you that. But when we look at recall histories of different foods, well, raw food always gets blamed for everything. It gets blamed for being full of salmonella and E. coli and God knows what else. But when we look at recall history of foods, it's actually not the raw foods that are being recalled much. It's mostly kibble foods for, bacterial contamination. So I think in the end, you have to do what you feel comfortable with. Some people, they just say, I'm just going to go for raw. I have some dogs that went through chemo because of cancer, which also diminishes the immune system, and they insisted on keeping their dog on a raw diet, and they didn't change that, and it didn't seem to make a difference. So in the end, you have to do what you feel comfortable with. But any food can have contamination of microbes, really. But compared to human food, human food is under the auspices of USDA, and pet food is controlled or regulated by the FDA, or checked by the FDA. And the FDA has a 0 tolerance policy when it comes to microbes. So you can't even have one microbe on the food. Whereas, for example, if you buy chicken at the store, I don't know what the percentage is, but there's not, the USDA does not have a 0% tolerance for human food. So whatever you're getting from your pet food is probably cleaner and has less microbes, which, microbes are part of life. So how are you ever going to not have any? But that's a whole different subject. Do we have any more questions, Jindy? Or are we close to the end? Oh, there we go. My Yorkie life. Do you have an animal communicator recommendation? Yes, Miranda Alcott, who you listen to, hopefully, or will still listen to on the summit. She's an animal communicator. There's also Joan Ranquet. She is somewhere in California. She's been doing it for a long time, and so these two are definitely who I can recommend. We have some up and coming animal communicators, but we'll wait on throwing them into the fire here. Yeah. All right. Any other questions, or is that? Oh, okay. So Steph, he's off all the drugs. It was the internal medicine doctor who told me that. Yeah, they tend to be a little bit more worried about that, and I think it's a part of it is also they just don't want to end up being responsible if something were to happen. So that may be a part of it, but generally I have found that they do pretty well, even on a raw diet, especially when they're off all drugs. It should be fine. But again, every animal is an individual, and so oftentimes we also don't know ahead of time. It's trial and error medicine, unfortunately. Yeah. Joan Ranquet and then Miranda Alcott. All right. So I think we covered all questions. Actually, you know what? Let me just check because I had a list here as well. That was another one. Just another one for binders, I guess. How do you recommend administering bentonite clay? I know in humans you would drink it with an 8-ounce glass of water in the morning on an empty stomach. So I would probably, I don't know, maybe mix it with a little bit of bone broth or a little bit of goat milk or something like that, just so that it doesn't absorb everything that's in the food. So that's one way of doing it. And then another question was, is being itchy a normal part of the detox? And I just wanted to mention that again, that no, it is not, but it can happen. I had way back when I was doing a little bit of pet sitting, and my neighbor's little pug, she was quite overweight. She was on a really poor diet, basically. And in any case, when I was taking care of her, I went for walks with her more and didn't feed her quite as much. And so she started to lose weight. And the more weight she lost, the itchier she got. So in her case, it was a sign that she was not properly detoxifying, or that she was losing weight too quickly and then mobilizing all of these toxins that were stored in the fat. And then as a result, they were kind of stuck in the circulation and causing her to feel worse. So itching is not really a sign. But generally, I think there was one person who talked about, I can't remember who it was. I listened to too many of them today and yesterday and so on the last few days. So it's all jumbled up. But basically, you don't really want to have a lot of symptoms. And even if they show a little bit of symptoms, like a little bit of diarrhea or a little snotty nose or a little bit of tearing, they should feel pretty good in the process. They shouldn't feel really crappy. So because if they do, then you definitely need to slow down. And sometimes when they do not feel great, it can also be helpful to do a little bit of fasting or just feeding them a bit less, so that the body can catch up and can focus a little bit more on detoxing and use the energy for that rather than doing a lot of digesting. So, yeah. All right. Wow, we went for an hour and a half here. But thank you all for your amazing questions. You guys are, yeah, just I love you all, and thank you so much again for being here and sharing the love and listening and doing all of these amazing things for your animals. You guys are just so incredible. I feel so blessed to be part of a community who cares so much and also cares so much about the entire planet and doing better and learning and such. And it's we're all on a journey and we're all kind of stumbling along, because there's always more to learn. We've only basically scratched the surface. So I guess the last comment from me would be, be gentle with yourselves, be kind, and love yourselves just as much as you love your animals if you can. And if you catch yourself judging yourself, then stop it. Yeah. So, anyways, thank you all so much. And I believe next week, I don't know if I can spill the beans already. There will be the offer of, and I know I already spilled the beans a bit, but there will be an offer for the vaccine course, and then I will be doing a Q&A, I believe next Sunday as well. I'm sure you'll get the announcement on vaccines specifically. So, feel free to join and take advantage of it, because that course that I created took me probably about 3 weeks to dig in. There's a lot of history. It was really fascinating, actually. So in any case, yeah, take advantage of it if you feel like it. All right, and yeah, if you continue learning, continue signing up and listening to all of these summits. I know there are some amazing summits coming up as well, and yeah, just start applying everything that you're learning, just a little step at a time, and make sure you download the ebook, because that also has all the foundational things again in there for you to remind you, and it's free. And if you want to work with me or any of the other speakers, just reach out to them. Whoever spoke to your heart and to your mind and to your situation, just reach out to them. I'm sure they'd be more than happy to support you. All right, very good. Well, have a nice rest of the summit watching, and I will hopefully see some of you next week. All right, have a nice evening, everyone.